What is hip osteoarthritis and why is it causing you so much pain? And what can you do about it? Well, hip osteoarthritis is inflammation of your hip joint. That's what arthritis stands for. And so what your hip is a ball and socket joint. Now you see, both the socket and the ball are lined with a cushion called cartilage. Now in between the two surfaces of cartilage is a slippery fluid called synovial fluid. Now that does two things. It hydrates and keeps the cartilage moist so that it can absorb shock. And the second thing that it does is the fluid itself acts as a barrier to also help absorb shock, so that when you walk, those two bones don't clunk into each other and cause you a bunch of pain. Well, the very first stage of osteoarthritis is that your body starts to reabsorb that fluid in between the joints. The cartilage then starts to become dry and brittle, and now that cartilage cannot absorb shock quite as well. Very similar to if you leave a sponge on the side of the sink and it becomes very dry and brittle and it can't move very well. Well, as that ball starts to hit the socket, we start to get damage and inflammation to the cartilage. Now, over time, that cartilage can wear away to where the bone can hit into the other bone within the socket. And that causes a lot of pain and muscle spasms around your hip joint. So what we do at our office is the very first thing is we inject that natural lubricating liquid in a medication called Suparts back into that joint to help rehydrate that cartilage, build back up that fluid barrier so that the ball does not hit into the socket. You're going to notice that without that friction within the joint, a lot of the swelling and the pain within your hip is going to go away. Now, there are a lot of tight muscles and those joints haven't been moving for quite some time. So our physical therapists use the latest techniques to stretch and release those muscles and bring back full mobility to your hip. When you combine sports medicine with physical therapy, there's a lot that you can do for your hip arthritis other than just replacing that joint.